Hello everyone, my name is Gladys Lopez, Account Engagement Manager at Elsevier for the Nordics and UK, and I'm very glad to be here with you next to Swak, our Commercial Director for Advanced Clinical Decision Support Tools. Both of us, we're going to be presenting the Healthcare Hub that has been created by Elsevier for you to use it during these pandemic times. Let me start also saying that I'm very glad to be here at EMI's Live and be able to provide a demo of that is going to help to provide reliable knowledge for the frontline. And this started, as you know, because we at Elsevier, we are an international information analytics business company that leads the way in advancing science, technology, and health. And our commitment is also based on our portfolio. We have on clinical decisions, the portfolio as reference with products as clinical key, but at the same time, we have EHR integrating clinical decision support tools, such as care planning, order sets, clinical path, clinical skills, and patient education. At the moment, we're living this emergency, and this emergency that is a big emergency and the magnitude is extreme, that leads to an explosion of information and research regarding clinical decision. But also, we are aware that unfortunately, that leads also to an explosion of misinformation. That's why Elsevier's commitment to provide evidence-based content led to the creation of the Elsevier Coronavirus Information Center. That was created last March and is open to the public and the healthcare authorities, researchers, and clinicians in order to contain and manage the disease as quickly as possible. However, we realized as well at the clinical decision side that we needed to provide some toolkits for the frontline. And that's why we have created the health that I will be showing in a minute. In simple words, this healthcare hub is created by us to help you to provide better care and improve patient outcomes during this emergency. So let me do a brief demo here with you, and I'm going to be sharing my screen so you will be able to see the Elsevier COVID-19 Healthcare Hub. It's very easy to access. Maria is going to be posting, helping us to post the address on the chat so you can access also on your computer. And please focus on three things. The first one is going to be the structure of the website, because you will be able to see that we're going to be navigating through toolkits that are provided depending on your area of care. The second one, I want you to invite you to see that it's not only the toolkits, but you are going to be able to at the same time. And the third point that I want to emphasize here is also that the Elsevier COVID-19 Healthcare Hub helps you to keep abreast of the latest thinking. And I'm going to show you in a minute how you can take that point of view. So let me start with the first one. And it's just here in the main page. Here you will be able to find toolkits for healthcare professionals. These are frontline clinical tools and resources that you are going to be able to use depending on your area of care. Here, as you can see, you can read it yourself, but let me show that you have from community care toolkits, going for emergency, intensive care unit, and also physical rehabilitation. For the sake of this exercise, I'm just going to choose one of them, and I have decided to choose the emergency care. Here, you are going to be able to explore just clicking the clinical guidelines. So you just need to double click and then you're going to be directed to the new page. I want to highlight in this new page the structure that you are going to have in any of the other toolkits. And the structure is really easy to navigate because it's divided on what to know, what to do, and what to say. So let's start with the what to know. The what to know is trust medical knowledge sourced directly from some of our tools. These are, in this case, clinical key and nursing skills. I want to highlight that these COVID-19 related materials are open for you to use without charge. And that's why Elsevier is putting the effort to support the healthcare providers. You can see this knowledge as clinical overviews, as you can see here, drug information, e-learning, diagnostic imaging, depending on your area of care. Before we have knowledge, now we have resources. And these resources are going to support your evaluation and during different areas. And it's going to be the resources in form of clinical calculators, as you can see here, drug information, nursing and allied health care plans, nursing skills, order sets, procedure videos, and other links. Let me highlight here that it is really easy to access because you just need to click on something that you are interested, and then it's gonna open up right away either the video, in this case, or in case that there is a PDF, let's say, here, you're gonna have the PDF ready to use for you. Here, you can see the PDF, and you can also download that PDF. Then if we scrolling down, this first key point that I want to take is what to say. And the what to say area is for you to compare on your day-to-day activities the patient education brochures that we have here. This is either presented by videos or also by documents, and it's the same thing. As you can see the last highlighted here by another color that is going to indicate that this has been recently updated. As I mentioned previously, all the toolkits are behaving in the same way, in what to know, what to do, and what to say. So let's go back to the main page. And as I say, the second point that I want you to take of this short demo is that on one hand, you have the toolkits, but on the other hand, you will have also expert insights. And how you can access these expert insights is just by in this menu, expert insight, and it's going to direct you to this series of podcasts. We're aware that at the moment, all your time is either in the point of care or doing some research. That's why we have decided to create this podcast series so you can easily access when you are commuting or when you are on your free time. All these episodes are around 30 minutes. And what I want to highlight as well here is that these episodes also are concerning your well-being as a healthcare provider. For example, the last one is empowering the healthcare team, a path for resilience. So I invite you to use it because it's going to be something powerful for you to have. And last but not least, I want to provide the third point that I want to remember, and is that you can keep abreast of the latest thinking by having an approach and by visiting our healthcare hub frequently. And how you can keep abreast of the latest thinking basically is by knowing that this is going to be updated frequent. The two ways that you can check what has been updated is first clicking at the top of the page on the plus button, and you're going to see all the items that were updated in the last week. For example, 22 items have been updated since Monday. And here you're going to have a list for you to see what is up there. The other way that you can check what has been added is also on the daily rounds. You just check on the daily rounds and you will see what has been today's top updates. So as you can see, it's really easy to use. It will give you a quick, reliable answer when you are looking for something fast, and it will help you to provide better care. I'm really grateful for being here today, and I'm going to hand over the stage to Laura.
I'm Laura Zweig. Thank you, Gladys. On top of the Healthcare Hub that Gladys just presented, we are also working on COVID-19 pathways that are directly implemented into your EHR. We have identified new problems emerging in this fast-paced pandemic, We have seen that frequent updates to COVID-19 guidelines, just as Gladys just showed, make it difficult to stay abreast of latest information, and this can cause unwarranted variations in care and increase stress for practice staff and patients. We also see that palliative care requires a high degree of customization for each patient, given the high proportion with multiple diseases, which can result also in unwarranted suffering.
Sorry to interrupt, Laura. I think we've not got your full screen of your presentation. We've got your note screen.
Okay, sorry.
I think you might have to maybe just unshare and then share again.
Sorry. Okay, so in our conversations with GPs, we also saw that teleconsults for non-COVID-19 patients demand new ways of working, but the rate of increase in new teleconsult content guidelines from colleges, etc., is too great to stay up to date. And the focus on COVID-19 symptoms is causing delays for patients who have similar symptoms but other diagnoses. For example, children are presenting later in the course of bacterial pneumonia. And quality outcome framework payments have to be reorganized, and this is a significant source of revenue for GPs normally. And lastly, we saw that many pre-existing clinical processes are now creating extra burdens or even risks. For example, the use of warfarin anticoagulants that require high-risk patients to have frequent blood tests. So what we are doing, we are addressing these problems by building so-called computer interpretable guidelines to support GPs in real time with first triaging patients with COVID-19 symptoms that require teleconsultations and managing moderate COVID-19 infections in the community. We incorporate patient data from the EMRs, such as EMIS, to personalize the recommendations for each patient in front of you. And of course, we track the use of best practice guidelines and variants. So the mild COVID-19 is the best to demo the triaging of patients with COVID-19 symptoms requiring teleconsultation. So imagine you are in a teleconsult using the COVID-19 pathways. You enter the symptoms and then you get a working diagnosis and you get the confirmation that this patient is meeting the test criteria. And then the screening bit ends with the advice to seek medical advice in a GP practice. So very quickly you are confirmed that this patient meets the test criteria and has to be seen. Now imagine you're in your GP practice, you enter the symptoms, you make the orders, you enter the test results. So this patient now is not too ill, so hospital admission is not required, and you're getting home care advice. Depending on the symptoms and diagnostic workup you enter, the recommendations can also be ICU admission or hospital admission. So the benefits we aim to deliver with our COVID-19 pathways are increased capacity due to efficiency gains from more effective clinical reviews and management, and decreased unwarranted variations in triage and care due to timely access to the latest best practice guidelines combined with the patient record, reduced stress due to provision of clear recommendations with transparent patient-specific rationales, and decreased demand for secondary care services due to more effective management in primary care, especially for patients with complex and multiple conditions. And lastly, improved data collection and reporting. So thank you very much.
Thank you, Laura. And if you have questions, please just type them on the question and answer area. And due to time, I think that if you also give us your details, we're going to be able to provide feedback to you.